To view a patient's chart, simply click on their first or last name, use the global search feature, or access it from the appointment module. A patient chart provides a comprehensive overview of a patient's health, medical history, ongoing care, and future health needs. The overview section offers a summary of key information, including demographics, current health status, active problems, medications, allergies, and recent healthcare encounters. To upload a document, click the Upload button in the top right corner, enter the title, select the category, upload the document, add any notes, and then click Add. Easily scan and upload documents using the Scan option. For this, click on Scan, Download, and install the Dynamic Web Twain service. This is a one-time download. Place the document in the scanner, choose the scanner, and then click Scan. Crop or rotate the document as needed. Enter a title for the document. Select a category. Choose PDF or another format. Select whether to save the current or all pages, add any notes, and then click Upload. The scanned document will appear in the Documents section. By clicking on the file name, users can preview and download it to their system if needed. Information such as social history, surgical history, medications, allergies, procedures, problem list, family history, and vital signs are automatically populated from the visit note. The Visits section stores visit notes for every patient-provider encounter. The Immunization section lists all vaccines and immunizations the patient has received. The Tasks section helps track specific actions or to-dos related to internal communication among healthcare providers and patients' care. The Appointments section shows both scheduled and past appointments with healthcare providers. Recall is a feature that helps providers track patients who require follow-up care, like vaccinations, screenings, or chronic disease management. The ESB screen simplifies the process of managing and generating superbills for patient visits. Add, edit, and view journals in the Journals section.